Hello, Soonhyung Lee. I'm very
Hello,
happy.
Kitty.
Hello. I'm very happy to have you as a small interview. And I would like to ask you first if you like to introduce yourself shortly.
Yes, thank you. Thank you, Kitty, for inviting me in this great interview. And I'm Lee Soonhyung from Korea, and I became an instructor in 2023. And I'm a physiotherapist with 24 years of experience. And I started my career as a PT in 2003 as a at the general hospital. At the moment, I treated patients with neurologic patient and orthopedic and elderly patients. And a few years later, I worked with the pediatric and many different types of adult patients at the National Rehabilitation Hospital. And later, now I'm working in my practice.
Great, great. And when we are thinking about the IPNFA, this is the reason why we do this interview. You just finished last week, right? As
Yes.
ICC instructor candidate. So we can say your assistantship is over. Would you like to talk a little bit about the time as assistant in the IPNFA?
Yes, my first assistantship was 3 years ago. At the time, I was so nervous because this is my first time, and also especially in my but after a few times, I adapted this system, and nowadays I have many experience with many different instructors. So finally, last week, I assisted Terry, who is a senior instructor from Vallejo, during a basic course in Korea. So in after this course, I received the recommendation for the ICC, and I was very happy and grateful because it was an important step for me.
Amazing, great. And we can say in the IPNFA education, normally you only need five basic courses, right? And three advanced courses with the assistantship. So this is the base. And
Mhm.
I know, can you tell us? You did much more. Can you tell
Yes,
us how many you did?
mm, I assist uh, more than 12 basic courses.
Amazing,
Yes, and three advanced courses.
right.
Last week, I counted how many times I had a demonstration on my uh, teaching unit. Surprising. Yeah, I had 36 times.
Wow, really amazing. And but I think we really can say, and it's the same for me, even as a senior instructor, we learn all the time, right? Learning
Yes,
never
right.
ends.
Yes, during my assistantship, I learned a lot from different instructor, from their great experience and knowledge and skill. And also we can chance to learn from the participants.
Right,
If participants ask some question about the patient or our lecture, uh, at that time I learned a lot because whenever I teach some lecture, if they don't understand or misunderstand, After that, I'm gonna change my strategy for teaching.
Great. So, and
Yes.
the Public Relation Committee, I'm the current chair this moment. We start already to highlight the title from our
Mhm.
members in the IPNFA, and it's so great and it's amazing that the young assistant, the young instructors, they all have the title, right? Because you study. It's a totally different education, like still in Germany, for example. And can you tell us about, because you have the highest title, you have the PhD title. Can you talk a little bit about this? What you researched and what was the content?
Mhm. Yes. I completed my PhD in 2023, 13 years ago. Wow. My research was about gait training using the auditory stimulation in patients with hemiplegia. At the time, many studies used auditory cues for patients with Parkinson's disease,
Mhm.
especially for gait speed and symmetrically.
Wow.
And however, I was treating many stroke patients, so I wanted to improve their gait function using this idea. So in my study, uh, we provided the different sound during the walking. A lower pitch sound used when patient steps with the affected foot, and high pitch sound was used when patient stepped with the unaffected foot. For
Mhm.
example, when your patient left-hand patient step forward, at the time, dick, make
Ah,
a dick sound.
yes.
And at the time, patient contact foot.
Great.
And right on the vertical side, step forward with this thick sound, more
Hmm.
high twitch.
Great.
So
Great.
yes, the goal was to help the patient walk more symmetrically and speed up.
Great, great. So,
Yes.
and for the viewers, we can say we will give, of course, the abstract from
Mhm.
your PhD, and we'll publish this in 2 weeks. And yeah, that's so great that you are doing this work, and it's very helpful for our treatment. And I hope that viewers then have also ideas how to treat the patient better and have more ideas. That's really
Uh,
amazing. And we didn't
uh,
mention that the PhD is, of course, in Korean because you are from Korea, right? From South
yes,
Korea. So, and
yes, right.
then I will come to the other question because you are very active as well in the
Mhm.
group, in the national group. We have two national groups in South Korea, but you are active in the biggest one, KPNFA. Would you like to talk about this a little bit?
Yes, in Korea, we have 12 branches in KPNFA. I'm working in the Seoul South branch, and I was ex-president in my branch 2 years ago. At that time, I organized many courses with different IPNF instructor, and I held the workshop and seminar online and offline. And then uh, this kind of active things can promote the PNF in Korea.
Great, great. Yeah, and this is so important to promote PNF and also what you mentioned, give workshops because it's our courses, basic course, 10 days. Not everyone can afford this from
Yes.
money and also from holidays. So this is really, really great that you also have this kind of workshop. We are very thankful for these national groups, and this is what we like to spread in the IPNFA, our knowledge all over the
Uh-huh.
world, yeah? Right?
Yes,
And for this,
right.
we
Yes,
need you people in these
yes,
countries. That's so great. Yeah.
yes. Whenever
So,
I my sorry, yeah, whenever many participants attended the IPNF course in my branch, and they always said to me, "Oh, IPNFA is very nice to treat and evaluate patient, and it's a very nice tool for the patient."
yeah. Yeah,
Thanks a
that's
lot.
good. But I would wonder because from my point of view, you are still a very young now, very soon instructor, still candidate. Is there any special you would like to give to the younger, to the
Mhm,
students as a PT?
mhm.
Is there
Yes.
something you like to give them
Mhm,
advice or
mhm,
ideas or
mhm.
yeah?
Uh, I'd like to recommend to learn PNF and just do it.
Yeah, right.
Yes.
Right. We
Yeah.
speak quite often in the course. I learned this from Amada, a
Mhm.
Korean assistant for
Yes.
she's saying all the time Nike.
Yes.
Just
Right.
do it. Yes,
Yes.
learning by
Yeah.
doing. Yeah. And
Yes.
this is
And
so important. I
yes,
really
that's
like
right.
I like
Mm,
that you do a lot of research, the
mhm,
young people
mhm,
and
mhm.
PhD, and you have these 5 years
Yes.
education on the university when you are
Mhm,
going for PT. But
mhm,
still, PNF luckily is a hands-on
right.
concept, right? And
Yes. Mm,
we really need this, and this is the reason why the people coming and learning, and
mhm.
we still allowed to come in such academic,
Yes.
educated
Right.
colleagues,
Yes.
right?
Mm. Yes.
Yeah,
Especially, PNF is very detailed and practical in patient treatment.
yes,
Uh, because when I was young, was young PT, I really wanted to treat patient well. So I attended many different courses and educational program. At first, I completed the POBAS course, and later I attended my first IPNFA basic course.
yeah,
And after I began to see positive changes in my patient, and it motivated me to study PNF more deeply. And
great.
then uh, over the years, I also studied many other concepts, such as Boba's basic and advanced course, and Mulligan, Cartambon, and functional kinetics, and
Yeah,
so on. Yes,
great.
but this learning, these different approaches helped me a lot.
Yes,
But especially PNF mm, and this kind of application patient can more effective to my patient. So uh, that is why I would like to recommend the young therapists to learn PNF early in their careers.
right.
Yes,
Yeah,
I believe that if they build their clinical experience based on the PNF concept and then add the other treatment concept later, they can develop a very strong foundation as PT.
yeah, yeah. Yeah, I think this is important what you said, especially when you
Mm,
are later on alone and finish as an instructor, that you also know other concepts, because what I think it's very important that we understand what the
mm.
participants are talking about, because we have
Yes,
a
right.
lot of skilled,
Yes.
very skilled participants. They are
Mm,
really good in other concept, and
yes.
if you do not have any idea about a
Mm.
concept, it's hard to understand what they are talking about, right?
Yes, right,
Yes.
right.
Yeah.
Yes,
Yeah.
and PNF has very detailed, as I said before. For example, it explains very clearly how to use manual contact
Yes.
and how position the therapist and patient and
Yes.
how to give the resistance.
Yeah.
This is very clear and detailed.
Great. Yeah, thank you very much. So I would like, if you don't have a very important uh, sentence to say, I would like to say thank you and great to have you in our group and looking forward to see you again in a course in
Yes.
the meeting this year in Vallejo.
Uh-huh.
Yeah, and
Yes.
it's all the time a great chance to go back to our roots. I
Yes.
also like it to be back, and it's feels a little bit like coming home. Even it's so long time ago that I was there for 6 months. So yeah, thanks a lot for giving us the time and talking so nicely about the concept.
Uh-huh. Yes. Thank you so much, Kitty.
You're
This
welcome.
thank you for this good experience and giving me this experience and inviting me. Thanks a lot.
Yeah, you're welcome. You're welcome.